Atrial fibrillation, or AFib, is an abnormal heart rhythm with symptoms often described as butterflies in the chest, affecting more than 2.7 million of us in the United States. And if you know someone who is living with AFib, you should know about the importance of having access to a reversal agent in the event of an emergency. And joining us now to talk much more about this, Dr. Timothy Woods. Good morning, doctor. Thanks for coming on Midday Maryland.
Thank you for having me. I appreciate it.
It's great to have you here. Look, we hear about this condition, AFib, many patients with this, and this is a critical factor, a risk factor for stroke as well. Tell us more about this.
Yes, you're correct. 2.7 million Americans have atrial fibrillation. Essentially, that is an irregular heart rate. Oftentimes, it requires treatment for that, and the reason we treat it, not only is it an irregular heart rate, but what can happen is the heart can pool blood. Basically, that irregular rate causes the heart to beat irregular. You get clot in the heart. That clot can move to the brain and can cause a stroke, which obviously we're trying to prevent.
Always on the lookout to prevent any kind of stroke. We know that. Anticoagulant and treatments in that area. Tell us more about that relative to people with AFib.
Sure. So anticoagulant therapy, or basically blood-thinning medicines, has been the mainstay treatment for atrial fibrillation for a long time. There are multiple medications out there that have that blood-thinning effect, and therefore preventing the clot from occurring and then hopefully preventing a stroke. Patients with atrial fibrillation are at 5 times greater risk of developing a stroke.
That's an amazing statistic. Let's talk a little bit as well about reversal agents and why those might be needed in conjunction with the anticoagulant therapy.
Sure. So we know that patients need the anticoagulant medicine. Unfortunately, there is only one medicine out there, Pradaxa, that has a specific reversal agent that will get rid of that blood thinning effect in that emergent situation. I'm a trauma surgeon, and unfortunately we see accidents on a daily basis. People have the need for emergent surgery or emergent trauma. The ability to be able to give a medication, and in this case Praxbind, in a patient who is on Pradaxa, I can get that patient safely to the operating room knowing that that blood thinning effect is no longer there, hopefully minimizing bleeding and hopefully improving the outcome of the patient. Unfortunately, there's only the one medicine out there that has that specific reversal agent.
It's key information, very technical, but the ideal being if you're in, say, a car accident, you're on a blood-thinning medication, you need to quickly be able to reverse that effect and not have that thinned out blood, correct?
Absolutely. And Pradaxa is that only medicine. The other medications we have the ability to reverse, but it's much more, or it's much less sensitive, and it takes significantly longer to do it, therefore potentially putting a patient at risk while we're waiting to try to reverse that blood thinning effect.
Doctor, very quickly, where can we head for more information on this?
First thing you're going to do is give your primary care doctor a call. Talk to him, have that discussion. Discuss what is right for you, if you need to be on a certain medicine or not. The CDC has a great website that you can go to as well. But atrial fibrillation, you need to know about it, you need to know the risks, and you need to know if your blood thinning medicine has a reversal agent.
Absolutely. Dr. Timothy Woods, thanks for joining us. And we will be back with more Midday Maryland right after this.